All right. Hi, everyone. Welcome to the Sign Ask a Neurologist podcast series. My name is Marco Salazar. I'm a fourth year medical student at New York Medical College. Today, I have the pleasure of interviewing Dr. Vinod Ravikumar, an assistant professor at NYMC. Dr. Ravikumar, thank you so much for coming on today.
Of course. Thanks so much for having me, Marco.
So we have a few questions we'd like to get through today in an interview with you. The first question I'd like to ask you is, could you tell us a little bit about yourself and how you chose to become a neurologist?
Of course, absolutely. So I was born and raised in San Francisco, in the Bay Area, and I was also I'm also a New York Medical College alum. So I was there, and I graduated in 2018. And from there, I went back to California for residency. I was at USC. And I also did a prelim year at Greenwich Hospital close by. And now I joined a practice up here in at Good Sam in Suffern, which is where I practice. And I do mostly clinical work. I do student mentoring and teaching as well on the side, do a little bit of research, and loving the practice. I've been an attending for about a year now. And I do general neurology. So I see basically any kind of neurological condition, anyone who wants to see a neurologist for anything whatsoever. So,
excellent, thank you. I guess as a follow-up to that, what are the conditions you typically see in your practice?
Yeah, great question. So we see a pretty diverse array of things here in the practice. I'd say that we see a lot of cognitive issues, a lot of memory loss. We see a lot of people with strokes or intracranial hemorrhages, kind of post-acute care. We see epilepsy and neuroimmunological cases like multiple sclerosis. And I would say that we could also see just the kind of bread and butter numbness, tingling, weakness. Can you help me explain where this is coming from sort of consult? So I see basically everything, anything and everything.
Thank you. Next, I wanted to ask you a little bit about work-life balance, and I have a couple of questions to follow up with that. I guess to start, would you mind describing what a typical work week looks like for you?
Absolutely. So in our practice, we cover the Good Sam Hospital for neurology consults, and we also have our outpatient practice. Typically, on average, we're in the office about 1 day per week, kind of, and we're at the hospital 1 day per week, and we also take turns covering weekends at the hospital as well. So essentially, on most weeks, on Monday, I'm in the hospital. Usually, we start our coverage at around 8 a.m. and we go until the early evening. And then during the rest of the week, Tuesday through Friday, I'm typically in the office seeing patients. And I would say that it's a pretty much, kind of business hours schedule. And and that's most weeks for me. On some days in the week, we also do share in a night call pool. And so we field calls from the hospital if there are any neurological emergencies overnight. So that's the job.
Okay. I wanted to follow up a little bit about work-life balance as well. How many hours do you typically spend in the clinic and in the hospital? And how different is that from your residency training?
Great question. So I would say that the hospital and clinic hours are kind of similar. Usually the hospital, I would say around 8 or 8:30 in the morning until 4 p.m. is pretty typical. And in the clinic, maybe starting a little later, maybe like 9 a.m. to 4 or 4:30 p.m. We do have stuff that spills over that endbound. For example, there are patients of ours, if they have clarification questions, if there are problems with orders, messages, I handle those after I'm done with my clinic days. So that can carry on for a couple more hours into the evening. So I would say that, that's kind of the hours. And in terms of work-life balance, I would say that I think a lot of it is setting the boundaries for yourself. So knowing your limits and things that are in our control as physicians is the number of patients we see, and with a lot of us, even the number of days that we work. So, I would say that for me, at least in my practice starting out, I think I started seeing more patients than I do now. I kind of had later hours, and I realized that I was really going late in the evening, so maybe pulling that back a little bit. And I think that it's definitely possible to find a good balance, and I definitely do now. I definitely have time to do things in the evenings with friends and family. So I think it's fantastic from that standpoint.
Excellent. Um, do you find time in your practice that you're able to do things like go on vacation?
Yeah, I actually have been on 2 vacations. I since I started, or big ones at least. I went to Thailand in I want to say it was February. Yeah, February, and I was gone for about a week and a half. And I was in Bangkok, and then I also was in Koh Samui for a wedding. And then I went to India to visit family in March or April. I think it was like the end of March, spilling into early April. So yeah, and then besides that, a couple of, with long weekends, going away out of town for a little bit. So definitely a lot of time to catch a break.
Excellent. That's great to hear. And I hope you had a good time on your trips.
Yeah, I did.
Um, so my next question for you, do you have any advice for an aspiring neurologist, myself being one?
Yeah, I would say that neurology is a great field. I think that when was, I've been interested in neurology for a long time. And I would say that when I was getting closer to applying to residency, so maybe uh, even starting in late college, but also in medical school, there was a lot said about how in neurology it's hard to, I think there was a thought that sometimes patient outcomes are very poor, and so it's hard to feel a big impact. But I would totally disagree with that being in practice. I feel that as neurologists, we have a huge impact on patients. I think the work we do is really important, and I think we can really change people's lives. And so I would say that neurology is a fantastic career. I think that you can have a great work-life balance. So I think it really is something that I personally feel like I can do for a very, very long time.
That's excellent. Thank you very much for the advice. What do you think some of the biggest challenges facing neurologists today are?
I think that with any of us in medicine, I think we had talked about this earlier, but finding that work-life balance is very difficult. I think that as physicians, we do take on a lot of responsibility. There's, especially with a lot of physicians, at least in the area, doing hospital and outpatient work, there are demands from both sides. And I would say that pacing yourself is very, very important. Specifically with neurology, I think the depth and breadth of knowledge is just expanding constantly, which is a great thing for patients, and it's so important for us to be on top of. But that also presents the challenge of being on top of things. And if you just look at, therapeutics for headache or for multiple sclerosis, even during my residency training, which wasn't that long ago, things have changed. Even post residency training, there have been some changes, especially with some of the Alzheimer's agents, which weren't really used, the infusions, which weren't really used when I was in residency. So the field is always changing, which I think is a great thing, but it's also challenging, and something that I think it's great to be a part of.
Thank you. I guess following up on that, you bring up some great points. Um, how do you think this field is going to change over the next few years? I guess in general, or if there's any other specific ways in your mind.
I think that that's a great question. I think that the field has become a lot more specialized, and there's a lot more awareness for conditions that may not have existed in the past. And I think you can just look at the kind of range of specialties that are available and the boards that are available in neurology today, which weren't available in the past. I think there's a lot more flexibility than there was in the past, and there might continue to be. So with things like stroke, I think in the past you would have had definitely an office-based job, whereas now with telestroke, you could reasonably just be remote the whole time, and you could do all your work from home. So I think there is tremendous flexibility, and I do see more specialization, especially because we have so many more drugs and so many more therapeutics to offer. Even with cognitive neurology, there's I don't know that it's boarded, so I could be wrong about this. Maybe it is now, but it's a fellowship, and it's, I think, relatively new that you can do it. And so it's very exciting that you can specialize in more things, and that there's great therapeutic options for patients in new fields.
Thank you. To follow up on that, this may be a bit too far down the road for an answer, but we'll see. How about over the next 20 years?
Wow. Yeah, I wish I could predict that, but I think certainly neurology is getting more awareness in popular media and the press, especially with a lot of the agents, a lot of the drugs that are out, and people coming out with conditions that were formerly hard to diagnose. I think people with cognitive issues, memory loss, and strokes and TIAs, there's just more awareness. And so I see us like going forward with people living longer, just more emphasis on these kinds of things, and probably more of a need for neurologists going forward too. So I think it is a big thing that we need more neurologists. We need more people in the field.
Bring up some great points. Thank you, doctor. My final question for you. This is part of a theme for the Ask a Neurologist podcast series. Everyone who's interviewed is asked this question. If you have a favorite part of the brain or the central nervous system, what would that be? And why did you select that?
There are so many good ones. And I think anyone who's interested or going into neurology, it's hard to pick one. I've always been fascinated with the thalamus. It is involved in so many things, and I feel like it's one of the most important, but also one of the least understood kind of parts of the brain, especially outside neurology. And so I would say that that's probably my favorite. It's something where whenever I pick up a book or go to a lecture that's on the thalamus, I feel like I learn something new every time. So definitely one of the most fascinating to me.
Excellent. Well, I just want to say a big thank you, Dr. Ravikumar, both from myself and from the student interest group in neurology here at New York Medical College, for agreeing to come on for an interview with us. Yeah, and thank you very much.
Thanks, Marco, and thank you everyone for listening.